Welcome. I am Dr. Patrice Berry, licensed clinical psychologist, and here I share legal and entertainment news from a psychological perspective. I took down the Psych Nerds banner for when I did the talk with my friend Betty. We did a conversation. We merged our brands to talk about ADHD. If you missed that stream, please go and check that one out. Today, we are going to be chatting about racism, unconscious bias, and discrimination. And I am going to talk about the Amanda Seals interview on Club Shay. I wasn't planning to fully talk about the autism diagnosis, but I want to because late autism diagnoses are very common in African Americans. And so I do think that this goes along with our topic. So we will be covering a portion of that interview. If you are a part of the replay crew, so by Wednesday, I should have the timestamps up if you would like to skip to a particular portion. Let's first start with just a definition of what is racism. And so I mentioned this on a video earlier today that race is technically a social construct. Recently there was an incident that happened, and in our area, they were looking for an individual who identified as a white male. But when you looked at him, he seemed to be Hispanic and or Latinx. And so people were in the comments saying that is not a white male, but you can be. So that's why they have white not of Hispanic descent, and they have white of Hispanic descent. There are some individuals that are a part of other communities that might identify with being European, with being white, but not necessarily connected. Often marginalized communities, so people from the less represented community, they are often very aware of their otherness early on. So I know my first experience with racism was when I was 6 years old. And there are some people that were not aware, they did not have experiences, they did not really acknowledge or see they're like, so most white people that I know, they don't think about being white. Like they just don't. And I like that we're able to have this conversation and listen and learn and let's talk about it. And so we are going to start with, like I said, talking about race being that social construct that's based on nationality, ethnicity, phenotype, or other markers of social difference. I identify as African American or Black, and my family comes from, we're not able to trace our family back more than probably 3 generations. Just because of slavery and records, we're not able to trace our lineage. We're only able to go so far because within the United States, slaves were considered to be property. And sometimes when people were purchased, they had a lot of control. And so there have been a lot of records that have been lost over that time. Racism is an organized social system that devalues and disempowers racial groups regarded as inferior, reducing access to resources and opportunities such as employment, housing, education, healthcare, and can increase exposure to risk factors. And so this is all researched. We know that this happens. And because this is from the CDC's website, and they know that there are certain factors that we know can impact a person's health health outcomes. And with this conversation, I was able to join and hear from, let me go here. All right, let's see. From Dr. David Williams. He's a professor at Harvard. I'm going to play because he's going to talk about the role racism plays in health inequities. And then we're going to chat about unconscious bias. And then we're just going to break down, because the American Medical Association, they acknowledged their history with race and racism. The American Psychiatric Association and also the American Psychological Association issued apologies for their roles in some of America's past, and even things that were in the earlier versions of the DSM, the Diagnostic and Statistical Manual, that because the APA, the American Psychiatric Association, is the one that gets together and makes that. I believe there are psychologists that are involved in it, but it's a lot of psychiatrists that talk about it, and so let's see. So I have done the DNA test. And so I have done both 23andMe, and I've also done, whoopsie, and I've also done ancestry.com. I don't have a particular preference either way. I wanted to be able to compare the results, and that's how. So in my family, we always talked about, and for some people will know what I'm saying, we always talked about, oh, we have Indian in our family. And based on my DNA, they did not pick up any traces of indigenous groups that are known to be in North America. What I am is about 20, I think 22% European. So that was interesting. And sometimes as African Americans, we don't know if that 20% or that percentage is consensual. I've been watching Finding Your Roots. That is a show that's on PBS. And there are many times where people are finding out that that part of their ancestry, it's due to violence. And because once again, slaves were viewed as property. And even after that time, during Jim Crow area, so Jim Crow is where there were specific laws. So that is where um blacks in the US received freedom, but there were laws instituted to make sure that they weren't able to vote, that they weren't able, there were these barriers put in place to make it harder to own land. Banks would deny loans, and there were all of these things, especially if it was for a particular area. And so all of these things happened along that time. And so I thought it was interesting. For our family, we believe that 20% might have been consensual. That my great grandma, that she, because my grandmother is very, very light skinned, and the rest of her siblings were not. And my grandmother was treated differently than all the other kids. And so we do believe there, that's me. And like, because some of the family, they, I don't know, because that would mean my great grandfather isn't who we say or think it might be. Like, there's some family secrets. I might try to apply to be on that Finding Your Roots show. Sometimes they do let people come on because they literally compare the DNA database to see like who your cousins are and who your second and third. I do not reach out to or connect because they will make connections with people on there, and I don't reach out to that. They do trace it back to like your root DNA, and so I think so, yeah. One day I'll have to do it in one, just sharing what my results were. All right, so let's take a look at this, the role that racism plays in health inequities.
Is this racism? Is this racism in society and in healthcare, or is
Racism is a significant contributor, I think, to it in multiple ways. Some ways in which the racism is obvious to individuals, and many ways in which the racism is not obvious to individuals. So let me give a couple examples. Back in around 2000, I was invited by the Institute of Medicine to serve on a committee that was going to address the question, what happens when Blacks and other minorities get into healthcare contexts in the United States? Does their race or ethnicity make a difference in terms of the medical care they received? The report by the IOM released in 2003, it was called Unequal Treatment. And what it documented, that was across virtually every class of medical procedures, from the most simple to the most complex, Blacks and other minorities receive poorer quality care and less intensive care. We were not addressing issues of access. The question was, given access to care, is there a difference in the quality of care received? And we found absolutely there
Yes.
was a striking difference.
And within medicine, there can be things that doctors believe that are not true. So sometimes there will be things in medical textbooks that might say that African Americans have thicker skin, or like even some of the imaging has been trained on lighter pigment, that sometimes certain scans and screening, it might show up different because of melanin, because of darker skin, or that some things, they just look different based on different, like I said, mostly like related to pigment and things like that. And so this interview is from, it was posted 8 years ago. So and I have the full links to these videos down in the description. All right. And I was able to interview Dr. Williams when I went up to Harvard. So some of you all know, and that's where sometimes I wear my Harvard sweatshirt. I was a part of their mental health creator program, and I was able to interview him and one other doctor. Her role, the thing that she really studies is things like how people are treated different based on hair texture, based on body size, how a person looks, how that can kind of impact their experience within the workforce. So
We we did not believe, the Institute of Medicine Committee did not believe, I do not now believe that the American physicians wake up in the morning
yeah,
and say, how am I going to get my minority patients today?
yeah.
I truly think that most medical doctors go to work, and other healthcare providers, and try to do their best for their patients. If that's true, then there's a conundrum here. How is it possible with people with good intentions seeking to do their best can nonetheless, at the aggregate level, create a pattern of care that is so discriminatory? Our answer was implicit bias. It's also called unconscious or unthinking discrimination. And when the IOM concluded that that was a contributor in 2003, there was a lot of circumstantial evidence. Today, the evidence is even stronger than it was then, that implicit bias exists among physicians and other healthcare providers, and that implicit bias affects the quality of care they provide to minority patients.
Can you help us understand a little better this implicit bias view? So I'm a doctor, a patient comes in, white, African American. What happens in my conscious or unconscious or in the interaction that becomes a generator of the kind of inequity you're talking about?
It's a great question. What the research shows is that most of us, and this is about not white people, this is about human beings, most of us think that we are driven by our conscious cognitive conditions. In fact, a lot of what we do occurs at a level beyond our conscious awareness, and is
And so he's going to go into the importance of the unconscious. And I will give a few examples of how my own bias could have impacted care, but being aware of it is really important. So I had somebody come into my office, and they had a ton of tattoos, and I just knew this person had like a really cool creative job, because in the back of my mind I'm thinking there's no way this person has a traditional job. But that was my bias with seeing their tattoos and assuming that they most likely had a more creative job. And the individual had a very straight lace, like they just they had a typical normal job. Or there's sometimes somebody will look at somebody with a bunch of tattoos and assume that they abuse substances, or they might look at a African American mom and assume that the child's father isn't in their life. I once had a family come, and I knew it was going to be a mom and a stepmom. And because of my like heteronormative thinking, and this was probably about maybe 8 to 10 years, this was a while back. My initial thought was, "Huh, that's weird that mom and dad's wife are coming in." And they get there and something, and the minute I saw them, I knew that they were the couple. And it wasn't dad's wife, and it was mom and mom's partner. And so sometimes there are these things that can cause us to automatically think, "Oh yeah, I know where this is going," and you're making an assumption, and that can be really, really, um, it can cause issues when you're talking about somebody's medical care. I will never forget having a family member that had a medical crisis, and just really being afraid that they might not receive the right care. Thankfully, they did. Thankfully, everything went really well. I did passionately advocate for them, but in the back of my mind, I'm thinking, don't be too angry. Don't be too forceful, because if I act in a certain way, I could possibly get kicked out of the hospital, or like I could be asked to leave, or something like that. They're just assumptions can cause major issues if we don't make sure that we're aware of bias. And so,
Importantly driven by ideas and narratives and stereotypes that have been deeply embedded in us as part of the culture or the society in which we were raised. There's a lot of research that indicates that in American culture, um, African Americans, for example, are presented as lazy and dangerous and violent. Those are negative characteristics. Um, Healthcare providers are part of the larger society. Research using the implicit association test, which is one test that tries to get at these unconscious implicit biases, finds that over 70% of all Americans have an anti-Black bias. And the number for physicians is also over 70% because they are part of the larger society. We are products of the culture. So it does not reflect then the behavior of bad people. It reflects the behavior of normal Americans who are reflecting the biases and the messages about race that they have received. Importantly, what the research shows is that when we have this negative implicit bias, this negative stereotype, even though we personally are committed to egalitarian principles, without our conscious awareness, when we meet someone who fits that stereotype, we will treat them differently and honestly will be unaware that we did it because there was no intent on our part. And that's why it's called unconscious, unthinking discrimination. It's implicit, it's not explicit.
and so that's where implicit bias or unconscious bias. And so that's why I started out the segment. I think most people try to, or they want to think that they always have, I don't know, like, I think most people don't want to acknowledge bias. And I think bias is incredibly normal, but I don't want to make decisions based on that bias. So I might see someone and automatically, like, because if maybe I see someone and I don't feel safe, but then I have to check, is there a reason why I don't feel safe in that moment? It's like, oh no, like there isn't, but that was a bias. Maybe I'm watching too much true crime. Like maybe I need to take a little break. And so now there's sometimes where, if in certain situations, if I get an unsure feeling about a person, and it's not all the time, it's not particular group of people, it's just certain situation, it was their behavior. I'll never forget, I was on the train, I was on the metro going into DC, when I went for my conference, and there was somebody having a mental health crisis. They were not crisis, it was just they were talking very loudly and aggressively to themselves. They weren't hurting anybody, they weren't hurting anything, and, I was far enough away where I felt okay. Nobody was, like, moving away from the person, like, everybody it was just kinda like another day and on the train. Like, nobody really did anything. If I was sitting closer to the person, I probably would have felt more uncomfortable, but it was because of, like, I don't do yelling. So if people are yelling and screaming, that is going to trigger my stress response, that fight, flight, or freeze response. And and so that's why I just think being aware. I know that there are some times that um I might I might make an assumption. So I like to tell families, I work with a lot of different types of families, so I don't want to assume. like I want to figure out who's who has relationships with who, like what's going on in the family, and I might ask a lot of questions because I'm trying to kind of get an idea and feel for the family dynamic, and versus me just automatically making assumptions and then basing like diagnoses or decisions based on those assumptions.
It. You're not looking at that person and saying, I'm going to discriminate against them. In fact, if I asked you if you did, you'd say I didn't because there was truly no intent. So it's something that we need to raise awareness levels of. There are a number of strategies that can be used to help clinicians and all persons become aware of this tendency that we have. The other point I would say, this is not just about race. Race is very salient. When we meet someone in American society, the research shows, we first put them into social boxes based on age, gender, and race. So race is one of the three big factors, social factors that we focus on. But it is a more general phenomenon. If I have implicit biases or negative stereotypes about fat people, about gay people, about old people, about women, those same processes occur. So I like to tell my students that I am a prejudiced person because I am a normal human being. And if we are normal human beings, we are prejudiced because whatever society we were raised in has raised us with negative beliefs about some outgroup. Every society has in-groups and out-groups. So the question just becomes, who belongs to an outgroup in the society in which you were raised?
And I think it's more helpful if you are actually aware of it. And so being aware and then looking at reducing that unconscious bias. And so I have this in my playlist for future therapists. And so if somebody down the road, if they're a medical professional, if they work in any setting, I think this information can be helpful. But how can providers or people in general reduce unconscious bias?
Nurse, and I believe what you're telling me, which is I don't believe I'm racist or acting in such a way, but there are unconscious um, biases at work. Can I unlearn them? Can I work my way out of it? And if so, how?
There are a number of strategies that have been shown to be effective. One of the basic override, well, I would say two things. The first thing is to realize that could be me. The typical healthcare provider, I had many talks to medical, nursing, and other health professional groups after the Institute of Medicine report came out. And the typical healthcare provider in the United States would say, I would never do that. I would never provide less pain medication to a Black patient than a white patient. Whereas the evidence is clear that Black patients get less pain medication with similar levels of conditions. So the first thing is to realize that could be me, and that people who have implicit biases are not bad people. They are just reflecting the culture and the beliefs that they were raised with. So that's the first point. The second big principle.
I like how he takes the judgment out of it, that this isn't about judging someone, this is about changing behavior and bringing awareness. And I agree, empathy goes a long way. And with the crisis with Black maternity, so when I was pregnant with our son, so there's been a crisis in Black maternity for probably for years. And there are certain states that have higher rates of mortality for African American women. But I think in almost every state, per capita or per the number of patients being treated, Black women are often the highest level of have the highest level of mortality. And individuals like Serena Williams. So I think it was with her first pregnancy, I want to say, she could tell something was wrong and something was off. And she had to passionate because her doctors were kind of dismissing her pain. She was kind of being dismissed. There was it Judge Hatchett? There's a famous judge. I want to say it was Judge Hatchett's daughter, because she was a judge on a TV show. Her daughter died I think in childbirth or after, because and the family could tell that something was wrong and it wasn't being treated as a crisis. And the doctors were slowly responding. They weren't responding to her pain. They weren't ordering the typical tests. They didn't feel like she received a high quality of care. And sometimes people, especially African Americans, people would think once I have a certain amount of money that like I'll be protected from the racism or other things that might be experienced. And it's just that's not true. Um I thought that with my doctorate, I thought that I would probably experience less racism in like healthcare or in certain settings. And I didn't necessarily experience more, but I definitely had times where um I just, for whatever reason, I wasn't believed, and I felt like I could have received better care. When I went into labor with our son, it just so happened that the only African American gynecologist that she was on duty that night, and she was my doctor. She specialized, so I had uterine fibroids, and uterine fibroids are very, very common with African American women. And there's a medication that can be administered after labor that helps reduce excessive bleeding. And my doctor explained to me, because of your fibroid, and we've been monitoring this throughout your pregnancy. Because of this, I'm going to give you, like, once you deliver, I'm going to give you a medication that's going to help reduce the chance of excessive bleeding. But this is a doctor that specialized in Black maternal care, and I can't tell you all like like it was honestly like it was a like the chances of me getting her. She only works certain nights, but I felt very safe in her hands. It just so happened to be a European American nurse who was my nurse for that evening. And she kept doing something that was making me uncomfortable. And I will say that I politely asked her to stop. If my mom was on this stream, or if you've seen any past videos where we've talked about this story, my mom will say that I aggressively told the lady not to touch me, and the doctor kicked her out of the room. And the doctor did. The doctor kicked her. I was not comfortable with her. I was not comfortable with what she was doing, and the doctor kicked her out for I think it was like 20 more minutes, and I had delivered our son. And so it's really important for us to talk about these things. Thank you, Lisa, for making sure that we covered that specific topic.
Is the challenge of focusing on what we call individuation versus categorization. What is normal for human beings as we process information is to put things into categories. So I see you, and I don't see you as a unique individual, Don Berwick, but I see you as a middle-aged white male. I've put you in a category, and in my mind, there are lots of associations that comes with middle-aged white male. So it's how do you look at a person, at your patient, at your client, and see that person as an individual, and try to understand the individual context of that person, as opposed to instantly seeing them, which is natural, because that's how we deal with the complex cognitive information we have to manage every day. We put things into categories. It simplifies life. It helps us to navigate our social world. So it's normal for us to do that. So that's one general principle. There are a range of other.
And I want to break that down. So, what he's saying is it's normal for us to put people into categories. Our brain likes shortcuts. So, when I meet a new person, I might immediately kind of put them into certain categories. And and then I might do confirmation bias, where if they do anything that goes along with that category, I might pay attention to it. And if they do something that doesn't go along with it, I might still keep them there. I might ignore that information. And so it's making sure that when I'm interacting with somebody, that I'm interacting with the individual, that I'm not kind of grouping all, you know, Black women in their 40s into one section. And that'll be because when we get into the Amanda Seals and just how the first part of the Club Shay interview with Amanda Seals, it was painful for me, but we're gonna watch it because in my mind there was so much. The interviewer Shannon Sharp, in my opinion, he was minimizing her experience, and he kept giving her like, "Oh, well, it could be this, or have you thought about this?" And that's the type of interviewer he is. I've seen him do that with other people, but if somebody's already told you that they're on the autism spectrum, like, and that they have some cognitive like rigidity, they're very black and white, they're very what's the word? The way that the word, I forget the exact word that she used, and we're gonna watch it, that they're very blunt. For you to then do that, that's going to feel like you're gaslighting them. That's just how it's going to feel. And we're gonna talk about that.
Other strategies that have been shown to be effective. One is trying to put yourself in the shoes of the other. So you have a patient who was an elderly Black male, and if you stop and wonder what his life was like, and what was it like for him to grow up in this society, and what are the things he encountered. So the extent to which you try to walk a mile in someone else's shoes, that is another strategy that has been shown to be effective. There's also a strategy that's called counter stereotyping, which means you think that all women are weak. Well, could you sit back some days and just imagine what a strong woman would look like?
Mm-hmm.
And imagine that women could be strong. So those are a number, but they're broad range of psychological strategies that have been shown in very careful laboratory experiments to minimize the occurrence of it. I would say two things. One is processes of implicit bias are more likely to occur when someone is working on the time pressure. So you don't have time to think. You just default.
So when a person is under a time pressure, and I think, and it reminds me of like ER rooms, or like in high pressure, in those situations where they're trying to work there really fast, and maybe a clinic that has a whole bunch of people, they're going through a lot of different clients. In those situations, if the provider won't take their time with each person, if they don't make sure to get a thorough history, if they don't understand that there's a reason why sometimes African Americans struggle with being fully open with medical providers. There is a mistrust of the medical system that's there because of history that only goes back like 40, 50 years. Like it doesn't go back that far of the Tuskegee experiment. And that is where they intentionally gave Black men syphilis, or Black men had syphilis, and there was a treatment for it. And they intentionally let these men suffer just to, without telling them what they had. And so that then not protecting their partners, but they documented what syphilis does to the body over time. And it was just for the pure purpose of just research and study. There was a treatment for a condition, and they let Black men die because of it. There's also, I want to say it was back in the 60s. They must not have been the 60s. It must have been because it was back during, it was enslaved women. Doctors did so this is trigger warning, okay? Trigger warning. Doctors did vaginal surgeries on women on Black enslaved women without anesthesia, and anesthesia was available. And it was just for the pure reason of saying, like, oh, I wonder what this will be like, or I wonder how this will be. And they might have written it up that the person didn't seem like the person that would put another human in that situation, like, it's very, very troubling. But those are things that have happened. That's the history that is there, and so that's why sometimes it can be hard for people to feel safe in those settings. So I acknowledge that when people come into my office, they might have fears of being judged. If I'm working with a family that maybe is using physical discipline, but they're not at the level of like where in Virginia it would be considered child harm. I don't have to report it to the CPS. There are some people that would hold back certain information because they're scared about, is she going to call CPS, or like what's going to happen? And it's really important that I have all the information so that I can provide the family with resources and tools, that I can give them education. And so that's where I actively practice non-judgment. So with and where a person hopefully feels like they can share exactly what's going on. I don't know if y'all know this, but like therapists, we have confidentiality. And if there isn't an active threat, so a person that got away with a crime in the past and maybe aren't going to do that crime again, there's no risk to, or we don't know that there's necessarily a risk for the future. And if somebody tells me they did a crime, there isn't anybody that like I don't have to, like, I can't report that to anyone. Like, there is confidentiality. There's doctor-patient confidentiality. Now, if a similar situation happened again, and if we think, "Uh-oh, oh, I think that might have been," that's where I'd have to consult with my liability insurance, and I would have to see what the options are there. But, there are things to protect clients.
Fault to your social categorization processes. It's also more likely to occur when you're dealing with complex cognitive information. In fact, researchers point out that many of the features of a typical encounter between a patient and a healthcare provider, the ingredients within that encounter are some of the very factors that social psychological studies show maximize the processes of implicit
Implicit
biases
bias.
operating.
I'll guess that fear can play a role in it.
Yes,
When you're
fear,
afraid.
anxiety
Yeah.
also play a role. Absolutely.
And sometimes that's why I think people engaging with communities that don't look like them, intentionally putting themselves in situations with people that do not look like them. Because then you get to, so if there's a police officer and if their only engagement with African Americans is at their job, and if it's mostly negative, that individual can pair that Black people are more criminal when that's not like, the data doesn't support that. Now, there are certain areas, so people are most likely to be harmed, like, in the area that they live. So, in an area that has, a lot of poverty, we know that there are things that can help reduce rates of recidivism, and then also that can help reduce people being incarcerated, like taking a look at second grade reading levels. So, like, I don't know if y'all know this, and I think they still do it this way, that if they're looking at building a new prison, or if they need to know how many prison beds they'll need in about 15 to 20 years, they survey the second grade reading levels. Meaning that if we can intervene and help address literacy and help address people that are struggling academically, that start to have issues before they get to high school, because by high school that individual might already be like in the wrong group. They might already, it might be more difficult to intervene that late. There are early interventions, there are things that can help. All right. So here is the American Medical Association. This was February 17th, 2021. So after the, I can say, murder of George Floyd, a lot of society saw racism in a whole new way. And I honestly think that there were a lot of people that never thought an officer would do, and I don't even want to dignify his name, what that man did, and the people that stood around and watched him do to George Floyd. There are other things that have been caught on camera. There are other situations. I just um, and there I personally do not watch the videos, because it triggers racial trauma. So if there's a video where an African American is unalived by an officer, or in a way that is like a lynching, I do not watch that because it's just it's way too triggering to see it happen, and know that it's really hard to stop those things, that there are people, so we know that there's more radicalism that's like happening in the United States. There's this us versus them mentality that can happen, because when even preparing for this video, like, there was a part of me that was like, there are some people that might be really like offended by some of the things that we'll talk about, even though I'm sharing facts, I'm sharing lived experiences, um, that these conversations can upset people. I do believe that we should do like Germany does. So I lived in Germany for 5 years. And in Germany, in order to not repeat history, they teach their role in the Holocaust. They accurately teach and at the age appropriate. Because, like, in first grade or the first year of school, what a child learns about history is going to be very different than what, excuse me, somebody in their ninth, 10th, or 11th or 12th year of school might learn. I think it's really important that we accurately teach history in the United States. I did not learn a lot of these things until I was in college and until I was in graduate school, and then I've continued to actively search out this information as an adult. I was blessed to have a really good my 10th grade year. That was my favorite history teacher. He's the only African American history teacher I had in like K through 12. He would take time to teach extra things about world history that was outside of the traditional text. And because when we learned about world history, most of the people didn't like we talked about Africa for, like, maybe, like, a few days. I don't know, like, it was just the history I learned. It wasn't the full gamut of what history is, and I do think that there's a way to accurately talk about this history, and it's not to make a certain group of people feel bad. It's not to make, like, but it would help kids understand why, um like, the history and what, like, racism is and why words matter, and, to just know and understand that deeper history, I think can really help. I tried to be blind to racism. So when you talk about being colorblind, I wanted to believe that, like, nobody would ever treat me differently because of how I looked. And I will never forget being in ninth grade. I had just finished watching Roots. So Roots is a very old, it's a old, no, very old. I think it's like maybe 80s. I don't know. I don't know. It's an older movie that kind of talked about history in a way that I had never seen it talked about that way. And I had just finished watching that, or I was watching that, and I was standing in line, and like and I was literally standing in line, and this white man just got in front of me like I was not there, and it was just like, "What?" Like, and I think he did not see me, and I was tall, so I've been 5'5" since I was, like, 12, or, like, it wasn't like I was a little child, or, like, I was a full, like, I was I look the same like I look now. And this person just, they did not see me. And it could have been because I was young. It could have been for a whole bunch of reasons. But there was a part of me that was like, what if it's just because he just thought he could? He thought what he needed to do was more important than whatever I was there for, which is not right. It is not okay. And so the American Medical Association released something. And so in 2008, they conducted a 3-year study on the racial divide in organized medicine and publicly apologized for the organization's past discriminatory practices against Black physicians. Because at one point, the AMA actually excluded Black members. And so this is the American Medical Association, and you could not work for certain hospitals or you could not have certain jobs if you weren't a member of the American Medical Association. And so that literally cut people off from jobs, from opportunities, from positions. And it was solely based on race. And so, um, all right. And so there is more information of some of that past, and they kind of talk about what they're going to do to move forward. I wanted to switch to the American Psychological Association to people of color for the APA's role in promoting, perpetrating, and failing to challenge racism, racial discrimination, and human hierarchy in the United States. So this was released. I want to say this was also February. Oh, this was October. They waited it took a little bit more time for them to release theirs. This was October 29th of 2021. And so the American Psychological Association failed in its role leading the discipline of psychology, was complicit in contributing to systematic inequalities, and hurt many through racism, racial discrimination, and denigration of people of color, thereby falling short of its mission to benefit society and improve lives. APA is profoundly sorry, accepts responsibility for, and owns the actions and inactions of APA itself, the discipline of psychology, and individual psychologists who stood as leaders for the organization and field. And they talk about this in here because an apology without action is like, so they talk about specific ways that they want to address and that they want to help um support people. I'll never so, like, when I was in grad school, mindfulness wasn't really viewed. So I went to grad school in, like, 2024. So 2024 to 2029, and, mindfulness was not viewed as, like, a research-based intervention. But then, as a part of dialectical behavior therapy, Dr. Marsha Linehan travels to meet with these monks. I want to say Tibet. I could be wrong on the location, but she traveled to meet with indigenous leaders to talk about their how they manage life and how they manage things. And she learned a lot from them. And then she made a program strongly based on a lot of the things that she learned while she was there called dialectical behavior therapy. And so my pause is because if it had been a person of color that did the same thing, or the people that maybe were Buddhist or that maybe wanted to incorporate certain beliefs into their client's practice, they might have been viewed negatively. And so that sometimes in psychology, when something is recommended by someone that seems more like acceptable, sometimes that goes further than if it happens a different way. Uh, some of that is changing. So I always have to have hope, but some of that is definitely changing because right now, one of the leading experts on boundaries is a phenomenal African American woman. I've talked about her book, Set Boundaries, Find Peace, here a million and one times. I highly recommend her book, Nedra Glover Tawwab, and that's Tawwab. She has one of them, like her book on boundaries changed my life. And she also talks about things in a way that is very sensitive to culture. And what I mean by that is the cutoff culture. So that's where, like, if my family is harmful, I might cut them off. But for some communities, they will never cut off their their mother. So is there a way for them to safely engage with their mother and still set those boundaries and still protect their own safety? And the ways that she talks about that is when talking with a client who's going to visit a relative that's problematic, talking about, okay, so about how long can you be with them without losing it? And it's like, okay, about 2 days. Okay, so let's plan 2 days. Let's do a 2-day trip. Maybe you stay by maybe you s- get your maybe you get a hotel instead of staying at the house so that each night you get to leave and decompress. That there are some people that the idea of just like fully cutting off a family member, they're just culturally that's just not going to work for them. And it's not on the therapist to push their ideas onto the client. And I'm a big believer in that. Clients always want me to tell them what to do, and I just won't. I won't do it. I give suggestions. I'll talk about because really I want for them to find their way and make the decision that works best for them. Because I tell people all the time, they're the ones that have to deal with the consequences. like they're the ones that has to live that life, not me. And so I want them to come to a decision that they can, weigh those pros and cons. They can make the decision that feels best for them. Um, all right. So APA and many in psychology have long considered such an apology, but failed to accept responsibility. APA previously engaged in unsuccessful efforts to issue apologies in the past, including an apology to Indigenous peoples. The work done to make this apology to people of color a reality was led by people and voices of a broad cross section of today's APA members. And so I think they're just trying to say maybe it was a diverse staff. I don't know. But so they went on to talk about the resolution, talking about that. Since its origins as scientific, the disposition, displacement, and exploitation of, sorry, psychology has, through acts of commission and omission, contributed to the dispossession, displacement, and exploitation of communities of color. The early history of psychology, rooted in oppressive psychological science to protect whiteness, white people, and white, excuse me. I'm gonna drink real quick. All right. Because that's a word, that word right there. Epistemologies reflected the social and political landscape of the US at the time. Psychology developed under these conditions helped create, express, and sustain them. Continues to bear their imprint and often continues to publish research that confirms that conforms with white racial hierarchy. And that's a huge thing to admit and acknowledge. When we Because sometimes people will get really upset about testing and there are lots of tests that have cultural bias. And you can look up the cultural bias within a test. But when people make a test, if pred- if whites and Hispanics score high on a particular item, and then whites and Asians get it wrong, that test question in the past would be thrown out. I'll say that again. That's where we talk about racial bias in testing. So there are some tests that when they were developed and studied culturally, if communities of color, specifically Black and Hispanic, if those communities got the question right and whites and Asians got the question wrong, that question would be thrown out. Because they're almost saying, like, the unconscious thing or the maybe conscious, I don't know, the thing that's not being said is that they are considering whites and Asians as having like more intelligence when like that's, but they're literally developing the tests to test those things, and they're throwing out questions that communities like that marginalized communities do well on. And like hopefully that's changed. A new Wechsler test is supposed to come out. There are some tests that have less bias. The Stanford Binet, I believe, is supposed to have less bias. Um, I acknowledge. So if I'm testing somebody that doesn't have a history of being educated within the United States, that the test I give, the Wechsler test, that is going to that the scores are going to be limited because of like bias. Like the questions are going to be about things that people that have grown up in America have learned. And so yes, yes, yes. All right. And let's continue. And so um all right. Um Views have often been centered in research used to advance the careers of white researchers who became experts with respect to the ethnically diverse studied group without providing any follow up to that community or insight into the data findings and implications for the research community. So like let's say white researchers did research a community of color and they came to a particular conclusion, that it would have been good if they had went back to that community to discuss what they found, because there might be a moment of learning in there from that community. Um, and so it's a whole thing. So it goes on, and I have these linked down in the description as well. The last one is the American Psychiatric Association. This was January 18th of 2021. Their apology to Black, Indigenous, and people of color for its support of structural racism in psychiatry. And so they start off with that part. Early psychiatric practices laid the groundwork for the inequities in clinical treatment that have historically limited quality access to psychiatric care for the BIPOC community. These actions sadly connect with larger societal issues such as race based discrimination and racial injustice that have furthered poverty along with other adverse outcomes. Since the APA's inception, practitioners have at times subjected persons of African descent and indigenous people who suffered from mental illness to abusive treatment, exploitation, victimization in the name of scientific evidence, along with racialized theories that attempted to conform their deficit status. So, uh, if a client comes to me and they are talking about feeling like people at work are talking about them, and they feel like people are trying to get them fired on purpose, they don't feel accepted at their place of work, the first thing I'd want to do is see if like I would want like they might be having a valid experience, because some people might hear those things and immediately think the client is paranoid. Like they have this delusion that people are out to get them at work, when actually their experience could be incredibly valid. And so that's where I think it's important to listen. And then there are some people that are like having psychotic episodes, like there that definitely can happen. But if that's the only, I don't want to jump to psychosis based on that one statement, like just based on that one thing. If I'm working with a Black male that talks about, when they get on the bus, people move away from them, that is something that happens. And so often in the past, people's lived experiences weren't always valued and talked about. All right. So I want to make sure that we have enough time to talk about this one. So we're going to end on a bit. I don't know if this is a lighter note. I don't know what kind of note this is, but we're going to end on this note. So prepare yourself. it starts off good and then it goes downhill, but we'll watch.
Hello, welcome to another episode of Club Shay. I am your host, Shannon Sharp. I'm also the proprietor of Club Shay. The lady that's stopping by for conversation on the drink today is a multi-talented, prolific comedian, actress, writer, producer, director, TV host, syndicated radio host, author, podcaster, DJ, rapper, singer, poet, media personality, performer, cultural commentator, content creator, an industry veteran, social media star, NAACP Image Award nominee, hip-hop scholar, entrepreneur, CEO, a philanthropist, an activist, a Renaissance woman. She calls herself a common sense specialist, the people's favorite truth teller, or truth translator, as she prefers to call herself. She says what folks are actually thinking. Welcome to the show, Miss Amanda Seales.
You ran it down.
How was that? I mean, so how was the intro? Did I leave out anything?
That was the best intro I've ever had in my life.
You like that?
That was fabulous.
Because you was a little worried. I mean, when you came in, you was like,
maybe I wasn't worried.
You was like,
oh, you don't know.
You like, you're so formal. Why are you being
so? That's not worried. That's me trying to welcome you. That's not me saying. That's not
how you welcome me in my own house.
So, like, we start off because he knows that she often gets misunderstood. She has a very direct way of communicating, and people often misunderstand what she's saying, and they might call her difficult or all these different things. And she's not, like, she's just true, and she tells facts. Like, that's what she does.
No, because I know that I have a lot of energy when I come into a space, and people will be like, oh, it's a lot of, so I have been trained over the years to try to make people feel comfortable.
Okay.
So that's what I'd be trying to do.
Well, I'm trying to make you feel comfortable. Are you comfortable?
Yes.
Normally when guests come on the show, we like to have a toast. So it's bad luck to toast a spirit in water.
Okay.
So
a toast.
All the best. Thanks for stopping by. But I had to jump on this right quick.
Go ahead with it. I am. That's a loaded question.
Sorry, I skipped ahead a little.
How I'm evolving. That's how I am. I'm evolving. I've had a lot of information and a lot of slander at the same time.
Okay.
And in the past month, it's just been a very difficult time, but there's been really beautiful things that have come out of it that I will speak to, in this conversation.
Well, since we started there, we'll start there and we can go to another direction a little later. What started this evolution? What caused Amanda to all of a sudden see things, or not see things differently, but maybe see things as they actually are?
Because so many people were seeing what I was experiencing, and they shared with me that they had similar experiences.
Okay.
And so I recently was diagnosed as someone who has autism spectrum disorder, which is very difficult to identify in Black women because of racism.
So what exactly is autism spectrum? Because I hear people say you're on the spectrum.
It used to be called Asperger's.
Okay.
But that is no longer.
And so autism spectrum disorder, so the DSM-5 did get rid of the diagnosis Asperger's, but autism was in there before. And some people that were diagnosed with Asperger's did not fit neatly into the autism diagnosis. And so some people did lose their diagnosis if they didn't meet criteria for autism. And autism can be, because you just need somebody that's trained to look for the ways that a person manages things. And so yes.
Or what it's called, because to my knowledge, Asperger was a Nazi.
Okay.
Yes.
But what it simply means is that your brain functions in a different way. So you're neurodivergent, and you also have certain tendencies that are considered outside of what the neurotypical way of things is.
Okay.
And a lot of times that can have you present in a manner that people misrepresent.
Okay. Okay.
Which is the story of my life.
Okay.
And so when all of this started ballooning out of nowhere, and people were saying, you're unlikable and you're a bully. No, not you're a bully, but you're being bullied. And these were tropes that have been associated with me before, but I'm in a new level of visibility at this juncture.
Mm-hmm.
And you get people saying things like, you are difficult, you are mean, you are nasty, and you know that you're none of these things.
Right.
But they're attributing it to things that are not actually action-based. Like, I don't cheat people. I don't lie to people. I don't stab people in the back. I don't operate in mendacity. I am not duplicitous. I don't do none of this shit, but I have a certain tone about how I speak. And that makes people feel like, oh, I'm mean, because something about the tone that I speak in doesn't make them feel a certain way. So
can I ask you this? Not to cut you off, but were they people that you had relationships with? Were this in the workplace that you
And so this is where, okay, so I might, okay,
became difficult, or is this people that you just have general interactions with?
These aren't people I've met.
So it's
the people who are saying these things about me have never met me.
And that's impacting you?
Yes.
And so to me, he's not getting how, like, because I think it's hard to hear somebody saying things about you that are not true, or if they're misreading you, misunderstanding you, because I think all of her life she's kind of people pleased, or like she's just tried to fit in, knowing that she's different and unique, and she's going to get into that.
Why?
For a number of reasons. One, I am not a sociopath. 2, it is actually a part of being autistic that you are very, very, very sensitive to what people think about you, because you are always keenly aware that you are an alien.
And what she's describing isn't every person who has autism. It's not every person's experience, but she's definitely explaining her experience.
You are keenly aware that you are different. You are keenly aware that something is very odd about you, and you're always trying to make the room feel good. We literally just talked about it, because it's my habit.
Right.
It's my habit to try. I'm gonna cry already. I've only been here for like 5 damn minutes. It is my habit because I've always been labeled as this. You think you know everything. It's not that I think I know everything, but I really did know the answer. And I'm thinking I'm helping the room out by having the answer.
Oh.
But they like,
I think you're a know-it-all.
You're a lot. You're a show off. You're extra. In my sophomore year of college, I was put in a suite with 7 other women. And the day
and she's going to describe her experience of trying to get them to like her, actually paying for drinks to have them sit around and talk about how they did not like her.
This is related to how my brain functions.
Yes. But just because your brain functions differently.
So this man has already said he doesn't know about autism. Why is he arguing with her about whether she's autistic or not? But okay.
From, say, mine.
Yes.
So you feel just because your brain functions differently that's what caused it, or there's a clinical diagnosis
there are clinical diagnoses
for you?
Yes, there are clinical diagnoses for autism. Yes.
Yeah, I know.
When you take the tests, when you take the test, you're like, hold up, I've been thinking my whole life that this was a problem. Like the fact that I have to doodle, I have to draw all the time. I have to be doing things all the time to be stimulated. It's literally called stimming.
Okay.
Like the fact that when I'm a baby, I have to rock, like in a child pose, like literally rock. And my mom would be like, why is she doing that? We find out later, this is stimming. This is her literally dealing with her anxiety in a self-soothing way.
Okay.
The fact that even little things like, if there was a bowl of peanuts right here, I would be lining them up in a row. I'd be lining them up in a row. Like these are small things that are indicative of like your brain functions in a very particular way.
Right. Okay.
And that functionality also displays itself in your behavior. Right. So it's also atypical to the way that our society functions. So for instance, like this society is very keen on,
to me, and I'm gonna let her get back to it. When people are describing something that he maybe doesn't agree with, I think he's trying to come off as deep of like, well, could it be this? But it doesn't. It came off as dismissive, in my opinion.
People performing. There's all this phoniness
Mhm.
all the time,
Yes.
right?
Yes.
And when you are autistic, you literally are unable to even catch these certain social cues. There have been twice in my life where I was in a fight and I didn't know I was about to be in a fight because I just didn't understand the social cues.
Right.
I literally didn't understand what was happening.
Okay.
And so please go back and check out that full interview. She is going to explain it. And then she goes on to explain her experience with racism. And to me, he again is like, well, do you think it was just because the teacher, and she literally describes a racist experience. And he's just like, well, do you think the teacher just didn't like?
I'm talking about me being on this dance show. I was there.
Okay, I think I went too far. Let's see if it was here.
Was always raising my hand and just wasn't easily appeased by simply just someone being an authority.
Right.
And I love this because when she called my mom and said,
she corrected her teacher. So just for a little backstory, she corrected her teacher in class because her teacher was wrong.
I'd like to set a conference up because I have some complaints about Amanda. My mom said, well, that's interesting because Amanda has some complaints about you. And so they came to the meeting. It was my mom and Mr. Wright and Miss Cersei. It's all Black people at Dr. Phillips High School in Orlando, Florida. And this lady sat there and actually you and Mr. Wright had the same build. And Mr. Wright was like, all right, so, we're here to discuss Amanda disrupting the class with her talking. And she was like, no, Amanda doesn't disrupt the class with her talking. She actually helps the other students out. He's like, oh, okay. So is it about her grades? And she's like, actually, no, one of her art pieces is featured in our exhibit at the library. He's like, so what are we here for? And she's like, well, she corrects me in front of the class. And these three Black people are like, here we go with this racist bullshit, because that's really what it is. We're in Florida in the 80s and the 90s. And
but let me ask you this.
Okay.
Do you think she would have felt equally as offended if a white kid, because I'm assuming this teacher was white, right?
Mm-hmm.
If a white child would have corrected her, I think most teachers would feel some type of way if a child corrects them.
That's not for me to surmise. I'm just saying that my experience was this lady giving wrong information.
Yeah.
And I'm allowed to correct her. Now, this is the same lady who tried to accuse me of stealing. And when a white girl said, no, Amanda didn't steal it, I did. She was like, well, I think both of you need to go to the principal.
Right.
So to me, that was a clear example of racism. And he's going to again come back and be like, well, are you sure? And it's like, no. And later she's going to talk about being called the N-word, and he's going to be like, oh, kids are just kids. And it's like, no, that is for a Black student to be called the N-word by a white student. Like, and that child maybe didn't understand that word fully, but that can still be a racist experience. Like that Black child is going to experience racial trauma. Like that's just how it is. My child has not been called that word yet. I am preparing myself emotionally and mentally because I know that day will come. But this whole thing was just, so that's why when I was in my bachelor's, my one of my favorite teachers, Dr. Polina, he taught us about racism, and his view of racism was that you had to have power to be racist. So I like more of the anti-racist view where because there are people that are like the leaders of the KKK that will say we're not a racist organization. We just think like Black people, whites are superior to Black people. like that's not racist. It's like, no, like that's literally the definition of racism. Or there are people that will say like, I'm not racist. And they're clearly saying and doing things to uphold whiteness and not like calling out things that are harmful, and it just causes all kinds of problems. And so that's when I shifted more to that anti-racist view where even a Black person can uphold views that are racist. So I'm just saying that in general, if there is, so as a Black person, I can have another Black person come in and I might have unconscious bias towards that person that's of my same race. And I have to be aware of my own bias. And that's where all clinicians have to be aware of bias. Um, I am thankful and grateful that I have had some phenomenal, some phenomenal professors along the way. My very first client in graduate school, it wasn't a client, it was just a listening client, looked at me and said one of the most horrific things that my white supervisor looked at me and said, "Patrice, I'm so sorry. She shouldn't have felt comfortable saying that to you." And I didn't take it as like, but my supervisor looked at the situation and saw that was not right. That was not okay. You handled that as best you could. And the individual never returned to the clinic. Like they were, okay. Mm. And that was one of my first experiences with knowing there's some people that just because of how I look, they're going to make certain assumptions. They're going to think that I'm not as smart or I'm not as this or I'm not as that. And that's where sometimes African Americans in places of power or authority or that have like doctorates or whatever, they still feel like they have to know everything or like I have to be 10 times bigger or 10 times better. And I acknowledge there are some things that I don't do. So I don't diagnose autism because I specialize in assessing the effects of trauma. And I want to focus on anxiety, depression, ADHD, and like that's what I focus on. So I refer out if somebody's looking for a developmental diagnosis. I refer to other local providers that do that assessment. I don't have to do everything. And that was really healing for me. I have a friend that talks about imposter syndrome, and it's not imposter syndrome if my workplace is literally not set up for me. Now, it's amazing. I work for myself, and so that ends up being phenomenal. Thank you for mentioning Jane, Elliott, Lisa. So she is a white woman that has done like, so there are old videos that you can go on YouTube and look up the Jane Elliott videos if you haven't seen them. She normally asks a group of like white people, like, would you want to be black for a day? And like nobody raises their hand and like and which means that they're aware that black people are treated differently. And so there are some phenomenal educators out there. I try my best to put this information out here in a way that we can, like I said, that we can learn, that we can grow. I think that's how we can change things in society. And so if y'all have questions, let me know. If y'all need a follow-up video. So Saturday, we're going to stream on Saturday. I don't know what we're going to talk about yet. I have no clue. So the Chad Daybell case is going on this week. They resume court tomorrow. The Karen Reed case is going on. The defense is putting up a major fight in that one. And so I'm keeping an eye on that. The prosecution makes us all want to go to sleep. I've been watching that case with Emily D. Baker. She's been streaming that one live. And so if y'all have questions, if y'all have things that y'all want for me to cover, please let me know on the regular video. So let me know. And I hope you all enjoy the rest of your day. Bye.